What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey, joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm good. Hi, everybody. Today, Brian and I want to talk about anemia, so let's get right into it.
Yeah.
This is something I see a lot in my practice, and I can certainly speak to it from the perspective of a primary care physician. But anemia is not as simple as many people think it is. If you have anemia, then all of a sudden you need to start taking an iron supplement. And that's generally what people automatically think of, but it's much more complicated than that. But it's basically, what is it? It's basically a lack of healthy red blood cells. And your red blood cells carry oxygen to all parts of your body. And if you don't have enough red blood cells or unhealthy red blood cells to do that, you're probably going to have all kinds of symptoms, the most common one being extreme fatigue. And this affects everything, right? So this can make your brain foggy. This can make, if you're going to exercise or just going to walk or go up a flight of stairs, you can be extremely fatigued. You can feel like your muscles don't work. They get extremely tight and start burning after like very little physical activity. These are just some of the common symptoms that you may have with this.
I'm glad you mentioned those, because this is something I don't have any, obviously it's not within my scope to treat, but it's certainly something that I see as a personal trainer and as a physical therapist come up in conversation a lot, or
Right.
it be a limiting factor, it says the patient. So I'm interested to learn.
And even so, and if you're not oxygenating your tissues, right, like a cause of not being able to lose weight or not being able to burn fat can be anemia. So we talked about that in the past. So, and it's a very common condition. It's the most prevalent blood condition in the United States, but it's very, very common. I don't know, probably like anywhere from 3 to 6 million Americans. It's very common in premenopausal women, young women, just based on menstruation, which we'll talk about in just a second.
Mm-hmm.
Most cases are very mild and easy to treat. Some are not. Some can be extremely life-threatening. There are many, many types of anemia. There's well over 300 types, or 400 types of anemia.
Wow.
So we're gonna talk about some of the most common forms of anemia today.
So by definition, it's just a lack of enough red blood cells, correct?
Right. And that could be broken down into 3 groups, right? So you can have a lack of red blood cells by blood loss, right? So bleeding, right? Internal bleeding or external bleeding. That's going to not give you enough red blood cells. You can have anemia by a decreased production in the body, or faulty red cell, where your red blood cells just are not made the way normally. And then you can also have anemia due to red blood cells being destroyed before they need to. So you can think of things like hemolytic anemia with that, but we'll talk about that in a minute. But there are many risk factors that can increase your risk for developing anemia. So a diet lacking in iron and B12 and folate, those are the 3, iron being a mineral, and the 2 B vitamins that people tend to think about mostly or have in their head about anemia. So those 3 are kind of the most common go-to supplements to help treat anemia.
Yeah, that's the correlation I've heard is anemia and iron multiple times, but I know it's not that simple.
Right. So those things just don't allow hemoglobin to do what it needs to do, or you can't produce enough hemoglobin in the red blood cells. And hemoglobin are the proteins that carry oxygen to all your organs throughout your body. So, and you need iron to make sure that your hemoglobin is functioning appropriately. Also, you need B12 and folate, same thing, to help that function appropriately. But we talked about anemia caused by blood loss. So there's certain diseases that may do that. So think about microbleeds in the intestines. This can be from things like Crohn's disease, celiac disease. This can be things like peptic ulcers. You can think about hemorrhoids here, like that are internal, that are constantly bleeding. This over time can cause anemia. For women, heavy menstruation That's a big deal. So if women who bleed heavily every month, and what's heavy bleeding, I mean, the definition varies, but basically they're taught, in the research they're talking about like 16 soaked sanitary products, during one menstrual cycle
Right.
is diagnosed as menorrhagia or heavy bleeding.
What was
Um,
the number, Keoni?
about 16 soaked sanitary products, or
Okay.
about 80 milliliters of blood loss. And over time, that's going to create severe anemia.
Yeah.
So if you stay on top of that if you just stay on top of that as a woman who has heavy menstruation, taking an iron supplement can really help, can really, really help with that.
Is that your first? I'm sure we're going to get into that, but would that be your first recommendation, Keoni?
Yeah, I mean, I would definitely do blood labs, but yeah, that's typically what would be my first recommendation, just to accelerate the production of healthy red blood cells.
Okay.
Typically, if you're bleeding that much, you will have some iron deficiency going on there, because you're
Right. You're losing it.
getting rid. Yeah, you're losing it. You're losing it quickly. Pregnancy is a common cause of anemia. So you think about, you have to feed a baby, and so mild anemia is common, definitely not life-threatening, but it is something to watch for. And then any chronic condition that affects the kidneys or the liver may also cause anemia. So think about the kidneys. Kidneys secrete a compound called EPO, or erythropoietin, which helps it basically is a hormone that tells your bone marrow to make more red blood cells.
Yeah.
And then the liver creates something called hepcidin. We talked about this before when we talked about hemochromatosis. Hepcidin is a compound that basically controls iron stores. So you can see, like, if hepcidin synthesis in the liver is not doing well, that it's going to affect how well your body absorbs or doesn't absorb iron. So all these can cause, affect the red blood cell production and hemoglobin.
Right.
We've all heard of like sickle cell anemia. There are
Mm-hmm.
inherited forms of anemia. There's another one called beta thalassemia. These are all different forms of anemia. We'll talk about sickle cell in just a minute here. And then, there's autoimmune disorders, certain infections, any type of blood disease, exposure to toxic chemicals, the primary one being lead. Having high lead levels can lead to anemia. And then also certain medications can also lead to anemia. And the most common medications here that can lead to anemia are simple aspirin. And why would that be? Right? Because aspirin can degrade the stomach lining, create microbleeds. And then over time, doctors, they're not doing as much anymore, but just within the last, I don't know, 2 or 3 years, they started changing their tune on this. But it was usually recommended for all middle-aged men and above to take 81 milligrams of iron, or of aspirin, take a baby aspirin. And over time, that's not benign necessarily. I mean, you have to really make sure that you're staying up on your blood labs and getting your annual check, getting what's called a complete blood count. And we'll go over that in a second too, but getting a complete blood count to make sure that you have enough red blood cells and have enough hemoglobin to do what you need to do to deliver oxygen to your body.
Right. Yeah, it makes sense how obvious of a problem this could be.
Yeah, it's a big problem, and believe it or not, it's missed quite a bit. Even in my practice, I don't do a lot of primary care at all, just because I'm in an unlicensed state. But I still have a lot of people who are missed by their primary care physician that are anemic. That's their main issue, is anemia. So when you run the labs and dig a lot further, you see something that, this different types of anemia that can come up that are easily treatable, that can make the person feel like, $1 million once you find the cause.
In your opinion, Keoni, why is this so often missed then?
It shouldn't be, because I think, first of all, I don't think people are running the labs like they should. Another thing is, the most common complaint going into a doctor is fatigue. So a lot of doctors just write it off as something else without actually doing a lab or a CBC. You know,
Yeah.
I'm not quite sure. You know, some docs are maybe too focused on other things, and you know, some people, like one of my patients who had anemia, he was just taking this baby aspirin, been taking it for like 10 years, and never went back to his doctor after that. I just heard that taking
Mm,
aspirin was great. You know, it's good
yeah.
for
Yeah.
you,
Yeah.
prevent heart attack, whatever. You know, so there's a number of issues there.
I
Um,
got you.
yeah. So, you know,
So
I,
overall, you feel like the labs that are run are not extensive enough to generally, and that's how this
Um,
happened.
the you should you if you run a CBC, you should pick up the most common
Okay.
forms of anemia. You should be able to pick that up.
So it's
You
not that
just
you're just getting the CBC, the basic level lab, and that's not picking it up. It's just
it should if you have anemia, a CBC, most forms of anemia that should pick it up. You
okay.
know, because you're going to be able to tell. So you're going to be able to get an idea that something weird is going on.
Yeah.
You just have to make sure. This is one of the reasons that me and you stress. You know, it's a good idea to just go in and get your blood work at least annually. You
Hmm.
know,
Hmm.
and I know many young people tend not to do that. Also, older people, especially men, tend not to do that.
Yeah.
And you really should, because you can catch things earlier,
Yeah.
and it
Absolutely.
can make you feel really good. I mean, think about what the common symptoms of anemia are: fatigue and loss of energy. That's huge. If you can't oxygenate your tissues, you're just going to feel awful. You know, you can have arrhythmias with anemia. You know, the heart starts beating faster because it's like, what the hell's going on? We're not, you know, we're being deprived of oxygen here because we can't get red blood cells to the tissues. So therefore that brings shortness of breath. You have shortness of breath, you can have severe headaches. So you can see how some docs would be like, oh, you have a headache? Well, let's just treat it with this, you know,
Hmm. Hmm.
without really going into anything there. Difficulty concentrating. How many people complain of difficulty concentrating? You know, it could be
Yeah.
anemia. Difficulty losing weight. That's another one. Pale skin, leg cramps. How many people are known for getting leg cramps?
Yeah.
And the other thing also is, you know, typically docs will blow off men as far as thinking about anemia. You know, most men don't shed their blood
Right.
every month. Hence, you know, that's a theory out there that men, one of the reasons why men may not live quite as long as women, because they build up iron over time in their body and don't shed it like women do.
Hmm.
It may be one of the reasons why postmenopausal women have the same rates of heart disease after a while that men do. You know, this is all theoretical stuff, but yes, shedding your blood every month seems to have some type of health protective effect, unless you're just bleeding heavily all the time.
It's
And
interesting.
many women are, and many women even don't even know what the definition of bleeding heavy is. So they need to, you know, they need to know, because I've seen anemia in very young women
Yeah.
who, you know, just thought it was common. They didn't really know that, you know, they're bleeding an awful lot,
Yeah.
you know, or bleeding too long. Um, how about insomnia, man? I mean, you can see how you can miss anemia if somebody just comes in and goes, "Oh, you know, I have insomnia," and you're just treating that without, you know, doing objective measures
Yeah. Yeah.
when the
Absolutely.
cause could be anemia.
So it's such a wide variety and common symptomology, basically, that people
Yeah, yeah, and
express, and that's how it.
that's where you get confused, and that's where
Yeah.
docs, healthcare providers, may miss it. You know, as a personal trainer, as a PT person, I mean, that's something that you should really look into, right? When somebody says, you know, yeah, I mean, you know, I just don't feel well, or when I exercise, I just, you know, I just can't push myself like I used to. It's just worth looking into when you hear stuff like that.
Yeah. And just to clarify, the first step of looking at would be that the blood panel, the general CBC.
Well, the first step would be like any healthcare provider, right? Take your history, right?
Which
Like
sure, sure.
yeah, you'll get an idea there. You know, physical exam, and then, you know, your objective data is take blood. I mean, I'd say the thing that to diagnose it, you're going to have a CBC to be able to diagnose anemia. You can't just do it off of, you know, as you can tell with all the symptoms we described, you can't.
Right.
You can get an idea they may have anemia. I mean, you know, one of the things I do, especially when I do acupuncture, I'm always feeling the pulse, and I'm always looking at the tongue, and I'm always looking at complexion, right?
Right.
All of those can be signs, especially pallor of skin, or the tongue being slightly pale. Now, again, these are very subjective, not very objective, but that you can get an idea of anemia with that.
Yeah. At
And
least
then
blood flow and oxygenation.
right.
Absolutely.
And, you know, so what if you see that? If you see somebody that has pallor of the tongue, skin, maybe the lower eyelids, a heartbeat may be fast, they may be complaining of short breath, they have, you know, cold hands and cold feet, you know, you may be thinking, all right, well, let me just run some labs here, especially if they didn't do any of that.
Yeah.
So let's just go through the different types of anemia. Now, again, there are 400 different types of anemia, which, you know, I'm not an expert in anemia. I'm just trained as a primary care physician. So I know how, I can refer out, and I know when there's a problem, basically looking at a blood lab. And that's really the extent of what I want to go through with people listening, so they can get an idea. And that's why, you know, I just think if you think about these symptoms, and listen to this podcast, you can get an idea of, you know, is this a possibility? Because this is a very common condition out there. It's just going to help you and your doctor, you know.
Right.
So the most common form of anemia that I see, at least out there, is iron deficiency anemia, and that's just caused simply as a shortage of iron in the body. Like, you know, for your bone marrow to make red blood cells and make the protein that transports oxygen, which is hemoglobin, you need to have iron in there. If you don't have enough iron, you can't produce enough hemoglobin in your red blood cells. Okay, and hence you're
unoxygenated.
Yeah, so the name of the anemia tells you what the cure is, right? So if you're iron deficient, you need to take iron supplements. You may want to increase your consumption of iron-containing foods. The best iron-containing foods out there are, you know, animal protein, especially like red meat and stuff like that. So that even gets you an idea if somebody's vegan. Somebody who's been vegan for years on end and is very tired and doesn't have any energy anymore, they just might be anemic. They probably are. And also the vegan diet may, you know, requires also B12, which also plays a role in making sure red blood cells are healthy. And B12 is found mostly in animal products.
Can you give us a vegan option, Keoni? Like, what foods are high in iron and B12?
So as far as vegan options for foods that are high in iron, from a Chinese perspective, it's the red foods, okay? And this bears out research. The red foods would be things like beets, berries, red berries. What else? Blackstrap molasses is very high in iron.
Blackstrap molasses. That sounds like something someone would offer you on a dark alley.
Yeah,
I haven't heard of that.
Yeah, some people love that. I mean, it's like, to me, it's tastes awful, but blackstrap molasses has a lot of iron in it. But I just think about the red foods. I mean, in Chinese medicine, one of the herbs, it's actually pretty common now, is you can find it at Costco. Actually, I just bought a bag of it at Costco, are the goji berries, the little red berries. They look like raisins. Have you seen those?
Yeah.
Yeah, those things from a Chinese perspective can treat what they call in Chinese medicine blood deficiency. All right, which may translate into iron deficiency, the Western iron deficiency anemia, the Western diagnosis. So,
so do we see any iron in those berries, or do we see, like, in the research, positive benefits of eating those berries, and as it relates to your iron levels?
Yeah, so typically another red food are tomato products. Typically, like I know with tomatoes, as far as vegetables, they tend to be high in iron. So typically the red foods tend to be high in iron. That's not always the case, you know, but they tend to be higher in iron.
Okay.
So the other thing that you can do if you're vegan is cook with iron cookware, like iron pans. You know, you will get a little bit of iron from that. That will help also. But it depends on the severity. I mean, if it's pretty severe, you need to supplement with iron.
Absolutely.
Right. But think about again, let's just go through the typical signs and symptoms of iron deficiency anemia. Extreme fatigue, of course, right? That's kind of standard for all of them. Weakness, pale skin, chest pain, fast heartbeat, headaches, dizziness, cold hands, cold feet. You can get like brittle nails. You may have unusual cravings, right? Those unusual cravings may come about from not having enough iron. So you basically want to chew on like a dumbbell or something, it's like,
Yeah.
and it can also affect your appetite, making your appetite just not right. You have a poor appetite, especially in children and infants. So, you may crave things like ice or dirt or, who knows, like weird foods.
Yeah.
That may or may not contain iron, but you have these strange cravings all of a sudden.
Huh.
The second most common anemia is caused by vitamin B12 deficiency, right? And so vegans usually need to find some source of vitamin B12. And they're usually notoriously known for over time becoming deficient in vitamin B12.
Yeah.
This occurs when your diet lacks B12 primarily, but also other B vitamins like folate. So this would rule out, folate. Think of foliage, like leafy greens and stuff. So typically, if you're a good vegan and not just a carbitarian, or you're just eating junk food, typically you're going to have enough folate. Usually, it's a B12 issue. But again, you can do some tests to get an idea of if it's B12 or folate, and we'll talk about that in a minute. So this just leads to a vitamin deficiency anemia. So vitamin B12 anemia. This is, B12 is very important for nerve conduction. If it goes on long enough, you can have permanent neurological dysfunction if you go too long without getting your B12. So think about what may happen from like nerve symptoms, not signs and symptoms, like tingling, pins and needles sensations in the hands and feet. Sense of touch is off. You may have difficulty walking, stiffness in your arms and legs, brain fog, or even severe dementia can bring that on. So
as the student physical therapist, everything you just listed is nerve there for the B12.
Right. And when it's severe, you'll start seeing these things. That's why it's great to run the blood test so you can catch it well before it gets severe.
Right. And it absolutely speaks on what you're saying about how things could possibly slip through the cracks. Obviously, if you show up to the physical therapy clinic and you say you have tingling pins and needles on your hands or feet, my first thought is not B12 deficiency. It's just how we're trained.
Right. That's how you're trained. Right. That's how you're trained. I mean, really, it's the primary care physician that needs to catch that. But, more.
This is why you have the healthcare team.
But as a healthcare provider, you need to know this. You
Absolutely.
need to know that this is where it could be, because at least you can put it in your chart and be like, let's just rule this out. This may be an issue.
Yeah, absolutely. And like you said, knowing when to refer and to who.
Right. Another one is anemia chronic disease. So you can just think about this as any chronic disease, inflammatory disease, that can interfere with the production of red blood cells. All right. That can include cancer. That's Crohn's disease, any chronic inflammatory disease, rheumatoid arthritis, AIDS, HIV, almost all chronic diseases, autoimmune disease, where a lot of inflammation is being generated. You can get anemia, and that's going to be diagnosed as anemia chronic disease. The ones I just mentioned are the most common. Another one is chronic kidney disease. That's a huge one. Okay. And we talked about erythropoietin, the hormone secreted from the kidneys that helps your bone marrow make more red blood cells. If you have poor kidney function, you're probably going to over time become anemic. All right. So kidney chronic disease can cause anemia. So a lot of these things you've been diagnosed with a chronic disease, and one of the sequelae of it is becoming anemic.
Right.
So if you've been diagnosed with something, any type of disease, it's even more important to check in with your doctor periodically.
Yeah, absolutely.
So any type of bone marrow cancer, also like multiple myeloma, what else? Lymphoma, all of these things. If you have any type of bone cancer, you can just think about certain cells. Your bone marrow makes red and white blood cells, and there's many different types of white blood cells. So let's say that there's some type of white blood cell cancer, think about an overproduction of that, where it's overcrowding the bone marrow so that red blood cells can't be made appropriately. You can think about it
Yeah.
in terms like that. Another form of anemia, and this speaks to the bone marrow issues. It's called aplastic anemia. It is rare, but it is a life-threatening anemia, and it's just a significant decrease in the bone marrow's ability to produce red blood cells. Again, infections, autoimmune disease, drugs. A lot of times this can come on pretty quick, so it's not more like a chronic thing. Hemolytic anemia, this is basically, think about when the red blood cells are being destroyed faster than the bone marrow can replace them, all right? Your spleen can get into a vicious cycle. Like, one of the things that your spleen does is it helps filter out old red blood cells.
Okay.
And if it's compromised in any way, the more it filters red blood cells, the larger the spleen can get. And the larger the spleen gets, the quicker it filters red blood cells. And then you can see that this becomes a vicious cycle where you can become anemic. So, and we don't, and for that, we're not really sure that we can get an idea of some causes of that. They usually, when the spleen is not functioning right, something's going on with the liver. They are connected by the hepatic portal vein. So if you see something's going on with the liver, you may also see something going on with the spleen there also. Anemia caused by chronic lead poisoning. This is something that used to be seen a lot. You're going to see it mostly in children these days, but a lot of like abdominal pain, constipation, vomiting. These are usually signs of lead poisoning. Blue-black line on the gums, referred to as a lead line. You can see, usually you may see that in children.
It's more along
lead
the
just disrupt
GI line.
Right. So heavy metal, chronic heavy metal poisoning, the most likely one being lead, can cause it. If you're getting chronic red blood cell destruction, what are the other things that you may see signs and symptoms? You may see brown or red urine. Your skin can be jaundiced. You see this a lot in infants. Sometimes some of this is normal. But it also can be indicative of some sort of liver problem, symptoms of any gallbladder problem. And then let's just talk about sickle cell anemia just for a minute.
Yeah, absolutely.
This is one of the most common inherited conditions of anemia. And basically, as the name suggests, the red blood cells become sickled when under stress, or a higher proportion of them become sickled. And therefore, when they become sickled and they're not nice round red blood cells, they cannot go through the capillary beds easily and get stuck and like kind of glue up the works. And so you're more prone to severe fatigue, severe joint pain. In the abdomen, you may have pain there, in the limbs. You may see delayed growth. You're more susceptible to infection, right? And this tends to you tend to see sickle cell anemia mostly in people of West African or Equatorial African descent. You may see it there. And sickle cell anemia seem to have some sort of protective effect against malaria. So that's why you see some of these inherited anemias there. So, So anyway, it's just, people should know, because most people born in the United States will be tested for this as soon as they're born, if there's any type of history or whatever. So people should know that. Another type of anemia that you find mostly, again, this has to do, it's a genetic one. It's called the beta thalassemias. And it is another one of the most common congenital anemias. And basically this one has to do with hepcidin. Hepcidin is produced by the liver. People with beta thalassemia have low levels of hepcidin. And if you have low levels of hepcidin, you can't absorb iron as well. Or I'm sorry, you can't. I'm sorry, hepcidin will basically optimize his iron function. So whether it's high or low, you're going to have iron function disrupted. Let me put it that way. It's a better way to put it.
And Sorry, so you want your hepcidin higher or lower? Or you really just want it at a normal, appropriate level?
You just want it to be optimized, but so you can get an overload of iron when levels of hepcidin are low. Basically, if hepcidin is there, it can't regulate the absorption of iron as well. So you can get an overload of iron,
Got it.
which
Okay.
can be associated with something we talked about in our last podcast, hemochromatosis.
Yeah. So it's an inverted relationship between the two.
It seems to be
Got
be an inverted relationship. And I'm no expert on this. I've diagnosed beta thalassemias. Most people know that they have it. So, but it's just for our lack of understanding, I just wanted people to know that those are the sickle cell and beta thalassemias are the two most common forms of inherited anemias. Yeah. But let's talk real quick about how it's diagnosed. And the main test that you're going to do is a CBC, or a complete blood count. And this just looks at the various types of cells in your body. But the ones we're most interested here with anemias are the red blood cells. So you're going to do a red blood cell count. If it's low, you're anemic, just based on the red blood cells. Okay. But you can also get an idea. You want to look at the hemoglobin. That's part of the CBC. And the hematocrit. The hemoglobin, again, is the iron-rich protein in red blood cells, carries oxygen throughout the body. If that's low, you're going to be considered anemic. Hematocrit is a measure of how much space the red blood cells take up in your blood. So if you don't have a lot of red blood cells there, you're going to see, you're probably also going to see low RBCs, or red blood cells. So it's just think about hematocrit as the concentration of red blood cells in your blood. So low levels of hemoglobin or hematocrit is a sign of anemia. And then once we see those, and we tend to see those are low, we want to look a little bit further. And there's something called the mean corpuscular volume. And we've talked about these when we did our podcast on a comprehensive metabolic profile on the labs, the blood labs. We did, but an MCV, that's how it's diagnosed, is just a measure. So mean corpuscular volume is just a measure of the average size of your red blood cells, and is basically just a clue to the cause of your anemia. So in iron deficiency anemia, for example, red blood cells usually are smaller than normal. You can just think of iron not being packed into the hemoglobin there's not enough hemoglobin there, therefore you're iron deficient. The red blood cells tend to be smaller and have a low MCV. Okay. You can corroborate that with the MCH, which stands for mean corpuscular hemoglobin. Now you're looking at the hemoglobin, and that tends to follow the MCV, mean corpuscular volume. Okay, so the MCH, mean corpuscular hemoglobin, just basically means when it's low, the hemoglobin concentration within the red blood cells is low. And again, if that's low, you can pretty much rest assured that's probably going to be iron deficiency anemia, which is the main thing. So it's called microcytic anemia. So micro, small cell, small red blood cells means iron deficiency anemia typically. That's the standard medical textbooks tell you. Now, if the reverse is true, if MV and MCH are high, now you may be thinking of macrocytic anemia, where the blood cells are larger, and that is an indication of B12 deficiency, possibly. All right. So now by looking at that CBC, you can get an idea of, and these are the two most common forms of anemia, of really what you need to supplement with.
You're able to tell that one from the CBC?
Yep.
Okay. What's the test called again, Keoni, where you get an idea of the type of your type of RBCs, your type of red blood cells, like the shape and the quantity?
So there, it's called an MCV, mean corpuscular volume, and an MCH, mean corpuscular hemoglobin.
Okay.
All right. There's also another test out there, all these acronyms, but it's called the MCHC. Again, that stands for mean corpuscular hemoglobin concentration. And that's also a standard part of the CBC.
Okay.
And
so these are in the CBC, Keoni?
These are in the CBC.
These.
Yeah, when you do a CBC, you're getting all these tests that I've just mentioned.
Okay.
That's why the CBC is so important to do.
Yeah. Okay.
Yeah, sorry for that confusion. So yeah, guys out there, when you're doing a CBC, you are getting all of these.
Okay.
But anyway, that MCHC, just think about the MCV, MCHC, MCHC test. I mean, those are 3 different tests. The MCHC, as well as the other 2, they're just all, they can tell us what type of anemia you have and basically give us an idea of how severe the anemia is.
Okay.
There's another test called a reticulocyte count, and this basically measures, this can give us an idea of what's going on in your red blood cells. Reticulocyte count basically measures the number of young red blood cells in your blood. So if you have young, you can get an idea of the age of your red blood cells, and if they're immature red blood cells. If they're immature, they're not red blood cells. They're not going to do their job as well as mature red blood cells. This may give us an idea of what something's going on in the bone marrow.
Right.
So then we can look further and see, okay, is this like an aplastic anemia? Is this what's going on at the bone marrow level? You kind of then run further tests. So that's a standard CBC. I've seen a reticulocyte count on a CBC. Sometimes it's not there, but that's kind of basically the standard CBC test. But now you can go further, and if you really want to confirm the iron deficiency, because a lot of primary care physicians will say, oh, well, you have microcytic anemia, let me just give iron. That it may not always be the case that iron is the issue, okay? But if you want to go further, then you should follow up with the iron tests, like testing iron in the blood, serum ferritin levels. These are proteins that help transport iron, or transferrin levels, the iron binding capacity. This can really help us determine what's going on with the iron transport system, because maybe we can go deeper and deeper into that and find out, well, why are you iron deficient? Is there something going on with hepcidin or something like that plays a role in how iron is absorbed in the body?
Yeah.
So these tests will get an idea, and then we knew when we did the hemochromatosis podcast that these are pretty much standard tests that people run to help them diagnose hemochromatosis, which is an overload of iron.
Yep.
And if we're still not sure, there is a test out there called methylmalonic acid, MMA, and that's basically a substance produced in very small amounts that's necessary for human metabolism and energy production. And one step in that metabolism is that conversion of methylmalonic CoA to succinyl-CoA. If that conversion is not running smoothly, it basically means you don't have enough B12, because B12 helps that conversion.
Okay.
All right. So what you see is a high level of methylmalonic acid in the blood. It's not moving on to succinyl-CoA in that biochemical reaction.
Right. Okay.
So that can tell us if you're getting the buildup of MMA, that it's the B12 deficiency, and can distinguish that B12 deficiency from folate issues. Okay. But typically, when somebody has a B12 deficiency problem, I usually give a little bit more B12, or just give a high potency B complex. It's going to have folate and just cover my bases for the most part, and then test later and see if things come up. So with all those are the most common types of anemia. So really, depending on the type of anemia, really determines how you're going to treat the anemia. The most common types are, taking, iron deficiency or B12, folate deficiency anemias, but also you would supplement with those. But also, if it's a bone marrow issue, a treatment may just be a blood transfusion,
Right.
Or taking certain medications. If it's at the kidney level where you're not producing enough EPO or erythropoietin, guess what? You can take a drug that helps push that and helps your body make more EPO that would then help you make more red blood cells. If you know that the cause is, say you've been taking aspirin or taking tons of NSAIDs, a lot of times it can be the cause of internal bleeding, or you have hemorrhoids, ulcers, anything like that. Why treat with iron and B12 when the cause is microbleeds? You may be masking it, and over time that can get worse. So you really want to find the cause. So some of the tests could include like an endoscopy, colonoscopy. A lot of these things can help find the cause of anemia. So preventing anemia is really going back to like good preventive healthcare, right? Like staying up with your healthcare and going and seeing your doctor and getting your blood labs done. Or, you know, you can run these blood labs. You can run a CBC online very easily, and you can get an idea. I mean, it's not, you don't need to be a rocket scientist to read a CBC. Anybody can read it if they halfway know what they're doing. But still, it's good to go to your doctor because there could be so much more going on.
Yeah, absolutely. Seems like it's one of those things you really have to figure out the root cause to actually make a difference.
Right. And
Absolutely.
Sometimes you get it on. Sometimes it is just as simple as, you know, increasing iron containing foods in your diet, or taking an iron supplement, or taking a B12 supplement. But prevention is the key here.
Yeah.
And you can do a lot of prevention through just diet alone. You know, eating a high vegetable-based diet, getting good sources of protein in. And then if you're going to take supplements, I recommend taking a good high-potency B complex. I tell people to, if you're taking iron, my favorite iron, non-constipating form of iron, that's a major side effect of iron. That's why a lot of people go to their doctor and they're given an iron supplement and they don't take it because it constipates them. Well, there is a form of iron out there that will not constipate, and that's iron bisglycinate. You can find that online. You can come through our lab to find it. I have my favorite brands of iron bisglycinate, but basically a bisglycinate means the iron's bound to two glycine molecules that helps with absorption. So once it gets out of your gut, which you want it to get out of your gut, it won't constipate you. So it tends to be gentle on your stomach.
Yeah. And rhymes with magnesium bisglycinate.
Yeah, that's
There
right.
we go.
Again, and magnesium bisglycinate, my favorite form of magnesium because it's very well absorbed. It doesn't give you that laxative effect. So anyway, I guess maybe you could take iron. If you're taking regular iron, maybe take your magnesium
with it.
and oxide to give a laxative effect to counteract the constipating effect. But anyway, you want to get these things inside you, so absorbed inside you. So iron bisglycinate and magnesium bisglycinate are my favorite forms of minerals to get absorbed. But for anemia, iron, especially iron deficiency anemia, iron bisglycinate.
Okay.
What else is there anything else that we missed?
That was perfect for me. I was learning right along with the listener. It's like I'm familiar with these things, but like I said, I wouldn't know how to walk someone through it like that. So that was great.
Yeah, I guess the main thing is what I want people to get from this podcast alone is just, you know, a lot of these common signs and symptoms, they require objective measures, and they require you staying up on your health care.
Yeah.
And if you can catch these things early, these things are easily treatable and preventable. So, you know, and I guess that's kind of the message with all our podcasts, you know.
Yeah.
Just kind of stay up on your care so that you can prevent some of these disastrous things later on.
Yeah, absolutely.
All right. Well, I think that does it. Thanks for listening, everybody. Please send Bryan and I any suggestions about the podcast. By the way, before we end, Bryan, I just want to tell people a couple things. Bryan and I do this podcast. We don't make any money off this podcast at all. All we do is we just put it out there. We enjoy doing this right now. We've been doing it for what are we going on? 2 years now, right?
At least, yeah.
At least 2 years.
Yep.
We don't do a lot of marketing or Facebook ads or anything like that. We really depend on you just telling your friends about it and stuff like that. You know, we don't, you know, we're not monetizing this at least yet. And even if, and when we do, you know, we love doing this stuff. So I just want to let people know that, because I know some people get turned off by, you know, well, why are you guys doing this podcast? Well, first and foremost, we're doing it for the love of it. And Bryan and I learned so much from each other, and hopefully we can convey that knowledge to you. And our main goal is to help people be healthier.
Yeah, absolutely.
And the last thing I want to say about this, because I get comments from a lot of people on this, is why do you call it the Well Man's Podcast? Well, we call it the Well Man's Podcast because man, we mean mankind. So yes, women can listen to this podcast. Maybe we should change it to the Well Human Podcast at some point. I've gotten a couple of emails in my box about that. This podcast is for everybody.
Absolutely.
Yeah.
Absolutely. Humankind. Exactly. I agree. Well
All right,
said,
take
Keoni.
care, everybody.
Bye, everyone. We'll speak with you next week. Be well.